Bismillahirrahmanirrahim. Aspergillus lung disease. Types of the disease. Aspergillus fumigatus and other Aspergillus molds are ubiquitous fungi that can be isolated from the air in most houses, and this increases with increasing indoor humidity. Inhalation of spores can produce a range of diseases, some of which are related to each other and some of which are not. While fungi are now thought to be found in healthy lungs, the findings of fungi hyphae in the sputum should provoke an assessment. Classification: severe asthma and fungal sensitization, which it is IgE mediated from inhaled Aspergillus spores, one of many common antigen provoking airway inflammation and bronchospasm. The second type is allergic bronchopulmonary aspergillosis bronchiectasis, APBA-B, a probable evolution and progression of exuberant IgE and IgG reaction to Aspergillus in asthmatics with inflammatory damage to the airway and resultant bronchiectasis, but not actual invasion of Aspergillus into the airway walls. The third type is allergic bronchopulmonary aspergillosis, seropositive only, ABPA-S, similar to allergic bronchopulmonary aspergillosis with mucus plugging and distal consolidation that may fleet from area to area but without resultant bronchiectasis. This is one of the causes of pulmonary eosinophilia. Invasive Aspergillus pneumonia due to invasion of Aspergillus, typically secondary to immunosuppression. This is the fourth type. The fourth type is invasive Aspergillus pneumonia due to invasion of Aspergillus. It is typically secondary to immunosuppression, but increasingly recognized in chronic obstructive pulmonary disease and critical illness. This can be a multi-system disorder with Aspergillus invading almost any part of the body. The fifth type is chronic pulmonary aspergillosis (CPA), almost exclusively found in those with underlying lung disease leading to air-filled cavity or bulla. Most common risk factors are previous tuberculosis, non-tuberculous mycobacteria, COPD. Aspergillus IgE is positive with evidence of Aspergillus in the sputum. The sixth type is Aspergilloma, a symptomatic Aspergillus living and growing as a separate ball of fungus in a pre-existing lung cavity. If symptomatic, this is a form of CPA, which is chronic pulmonary aspergillosis. The last type is hypersensitivity pneumonitis, previously known as extrinsic allergic alveolitis, due to an immune inflammatory reaction to inhalation of large numbers of spores. The presentation and the clinical setting of these various Aspergillus-related disorders are clearly different and thus are detailed separately. Severe asthma with fungal sensitization. Approximately 10% of asthmatics are skin prick positive to Aspergillus species, compared with about 70% to house dust mite. It is assumed that this allergy contributes to allergic inflammation in the airways, but in the few relevant studies, symptoms have not always correlated with exposure. However, in some studies, asthma admissions to hospital correlated better with fungal spore counts than with pollen counts. Fungal spore release may explain an association between thunderstorms and asthma attacks, particularly high exposure results from working with moldy vegetable matter, e.g., compost heaps during the late summer and early autumn. A small subset of asthmatic patients with severe asthma may have sensitization without meeting criteria for ABPA. The screening test total IgE below 100,000 international units per milli. There may be a role for antifungal therapy in these individuals.